Hi, hi. Get in here, guys. Get in here. What's happening today? How is God keeping you? Do you have any good news to share? Well, I welcome you with my motto. This acts as the mother, this acts as a baby. Welcome back to my channel, and if you are a new subscriber, please sorry, if this is your first time here, please subscribe, press the subscribe button so that every time I make a new video you get a notification. Okay, stay tuned, guys. So for the returning subscribers, thank you for coming back. I appreciate your effort. I appreciate you for watching my videos. Please recommend to your relatives, to your sisters, brothers, to your next of kin. To someone you know they may need to understand this, or they need to know this information. Okay, so today we are going to look at the professional value stations in the midwifery OSCE. We all know so I should not say we all know. So the professional value stations include bereavement and bereavement care and safeguarding. Sorry, my light went off, so I panicked. Anyway, let's just continue because I don't have the time to charge it anyway. So let me rely on the light from my window. You see that? I'm relying on light from my window. So okay, let's continue. So we're going to begin with the marking criteria for safeguarding and bereavement. These stations, they're saline stations, so I'm going to add both of them in one because the information is not really quite a lot about them, since you need to just write down. However, I'm going to give you some important tips, and I'm going to share how to go about it of every station. Let me see if I still remember the IFIS. The professional value stations. I have a certain acronym that I did. Is it the IFIS? And I'm going to see if I can still remember it. Anyway, let's go in. So we're beginning with the marking criteria for safeguarding women and children. Marking criteria. As you can see, this is midwifery marking criteria updated January 2024. Okay, so in case there are new updates, I always try to keep you updated. Okay, all right. So number one, acknowledges the need to escalate the safeguarding concern without women consent, reflecting on the duty of candor. So what they mean here without consent is, once you notice a safeguarding concern, you don't need the woman's consent to raise the concern. Like if you find the woman bruised, has cuts, or has battered in the face, you don't need her consent to raise the concern. You need to raise the concern immediately to the people concerned, like the social services and the safeguarding midwife. Okay, then we go on to communicates. Number two is communicates with compassion and empathy in the language appropriate to the mother, and to the mother providing clear, balanced information about the outcomes of postnatal check. Okay. Three, identifies the need to act without delay, given the risk to the mother's safety, and to raise concern to the first reasonable opportunity. Okay, so as a midwife, you have the people, or you have guidelines on how to raise safeguarding concerns. So I think I'll find them. I will share them. Okay, raises concerns with the manager or local authority safeguarding lead in accordance with the safeguarding policy, recognizes the need to be clear, honest, and objective about the reasons for concern. 5. Makes a clear written record of the concern, including the body map and steps taken to deal with the matter, including the date and with whom the concern was raised. Recognizes the importance of advocating for the woman and the baby. 6. Acknowledges the need to keep the standards and values set out in the code. 1. Prioritize people, practice effectively, preserve safety, and promote professionalism and trust. Okay, that's it with the safeguarding. There are only six things outlined in that marking criteria. So we're going to see the marking criteria. So we're going to continue with the bereavement as I was showing you this. The bereavement care marking criteria. There are also only six points that they expect. Okay, so 1 is recognizes the importance of building a respectful and trusting relationship with the person, acting in the person's best interest at all times. So let's remember that in whatever we do, in whatever we think to do, should be in the best interest of the patient. Okay, then you should also create a rapport with a woman so that she's able to open up to you. Okay, then that's what we call the building the trusting relationship. Okay, use open body language, and then also use open-ended questions so that the mother can be able to elaborate on what she wants to explain to you. Okay, then provides clear, balanced information regarding the induction of labor process and gives the person adequate time to make an informed choice about her care, communication, and partnership. 3. Provides a individualized care and reviews the person regularly as part of a holistic assessment of her well-being and care requirements, which we call holistic assessment. Okay. 4. Recognizes the importance of providing respectful, empathetic, dignified care and promoting continuity of care and continuity of care. So number 5 is recognizes the importance of advocating for the person's care choices and works in partnership with the person and the multidisciplinary team as required to support the person's choices. Sorry about that. 6. Recognizes individual circumstances relating to stillbirth, including the arrangement of pastoral and spiritual care and supporting the family to spend time with their baby to make memories. Okay, we shall be sharing different ways on how we can help the bereaved family to make memories with their babies. They may also have got something in mind, but also remember that we also have to allow them to grieve in whatever way they want. Okay, so let me begin with how we handle the professional values. This is for both of them, under both of them. Okay, so greet and introduce yourself. Your name and role as a midwife. So you may say, my name is Sarah, I'm the midwife who will be taking care of you. Okay, so try to build a trusting relationship. So try to build a trusting relationship, provide privacy and dignity by opening the curtains, closing curtains, and the adjacent windows. Okay, provide the mother with clear and balanced information on postnatal checks in case that's a safeguarding scenario. If it's a bereavement scenario, provide her with clear and balanced information about the induction of labor, and give her time to make an informed decision. Okay. 5, review her obstetric, medical, social, and mental well-being history and mental well-being. In case you should also review the safeguarding history. Remember to check the system if the mother has any safeguarding history before, and any history of domestic violence. You can also check out for the abusive relationship and drug and alcohol abuse. Okay. Then we shall go on to perform a full head-to-toe holistic assessment of the mother if it is safeguarding and the baby. In that you check from the head to toe to see if the mother has any other marks or beatings or cuts or anything head to toe. And also make sure you also check the baby, okay? Because anything can happen. You can't assume the baby is fine when the mother has a safeguarding issue, okay? Then listen to her point of view respectfully and empathetically, and acknowledge her concerns. In this, you have to be the person providing a listening ear. Listen and take in and take note of everything the mother says. If you need clarity, you need to go on and inquire. But don't interrupt her when she's explaining, and whatever the mother says or whatever the patient says, that's it. Okay, it's a choice. You don't have to give your opinion over it. Okay. Then design a personalized continuous care plan. 9, remind the mother about the 6 weeks GP appointment for her and the baby screening, in case this is a safeguarding scenario. Okay. If needed, refer her to the. Sorry, we're still looking at reminding the mother about her 6 weeks GP appointment. And for her and the baby, in case this is a safeguarding scenario. Then, if needed, you also refer her to the GP for administration of medication to prevent engorgement. That is in case the mother is for bereavement care. Okay. Then you inform other members of the multidisciplinary team, such as the senior midwife, safeguarding midwife, the GP, then the obstetrician. That's under safeguarding. Then under bereavement, you inform the senior midwife, bereavement midwife, you inform the GP, you inform the obstetrician, you also inform the community midwife. Okay. Then you also refer the mother to the bereavement team. Okay. Then we go on to refer the mother to postnatal and spiritual care center. That is in case of bereavement, because most hospitals have the spiritual care center. Okay, according to the mother's beliefs or faith. Okay. Then we also refer the baby for pediatric review. That is in case of bereavement. Okay. Then in case of safeguarding, we're going to make sure the family is known to social services. This is for further follow-up. Okay. And to also make sure the baby is fine. Okay. So you have to also make sure the family that is the mother and her partner spend time with the baby and have a memory box in a private bereavement suite. So most hospitals have a bereavement suite whereby families who have lost their babies, they can go sit and you let them grieve. Okay. So that's the bereavement suite we are talking about. Then 14, advocate for her and her baby in their best interests. So that this is a way of reassuring the mother and the baby that everything you're doing, you and your team, is within her and her baby's interest. Okay, so that she has the confidence and trust in you. Okay. Then you also educate and give the mother and her partner a leaflet about stillbirth and support them to have a funeral. Okay, that is under bereavement. So number 16, you'll also consider other children. In case the family has other children, these children should also be talked to. Many children have different ways of experiencing their grief. Okay, they may seem playful and all that, but this also affects them. Remember, some of them really understand what's going on. They'll be, oh, my mother is expecting a baby. They'll be telling you all this. Okay, so imagine the situation whereby the mother's lost a baby. The children are hurt. Okay, so they're also going through a series of emotions, and you should be able to talk to them so that they are also catered for. Don't leave them out saying, oh, these are young children. They need to be catered for in your plan. Okay, so then you also share information and links and to the mother about where they can get more help. Give them all the information they need to find out. Then so document your findings, and then you tell the mother you can call us if you have any inquiries. Ask her if she has any more questions to ask you, so that you elaborate more about what she's saying. Okay, then after advising her to call you in case of anything, then you go on to sign. Remember, I told you this is a silent station, so you're just writing what you should have done. So you're going to sign down, write, this is midwife so and so, time and date. Are we together? So I'm going to go through yeah, so that is generally it. Please go on and pick wherever I've said that is in case of bereavement, right? That under bereavement, I'm trying to combine both of them. Then where I say this is under safeguarding, go and write that under safeguarding if you want to specialize them. But before they're almost similar. Oh, let's go on. So also we're going to look at some key factors, like in case the mother has the other children, we should look at the Children's Act 1989, that it has information. Then in case we have vulnerable children, that is in case of safeguarding. So this may affect the babies because they may have poor attachment or low self-esteem. Then they may have a disability or illness. They may also have history. They may also be at risk of isolation. Okay, so most time these children also end up being looked after under foster care. They have early childhood trauma. They are at risk of youth violence and exploitation. Okay, they are at risk of modern day slavery. They are also in case some of them also have difficulty in communication, like, you know, when the child is used to something, maybe let me say your children are Ugandans, you're speaking to them in Luganda, or your children are Nigerian, you're speaking to them in Igbo or Igbo language. What else? Yoruba. Then maybe say your children are from Ghana, you're speaking to them in your local Ghana language. Okay, then they're taken somewhere because of safeguarding and they can't get it, so they're forgetting what they know and also trying to communicate in the new language they're hearing. Okay, so I need to clarify still many things. Oh, yeah. This should be about the bereavement. Okay. Okay, so when we are communicating to the bereaved family, we have to put in these things in mind. One, the attitude and behavior of the staff that is communicating to them. Remember, this is going to leave a long-lasting effect on those people. They'll always remember how you handled them. If you handle them poorly, they'll always say, oh, that midwife, that nurse, that healthcare personnel did not handle well. That person said this, okay? So it's very, very important to look at how you're handling them. Your attitude and behavior is very important in that moment, okay? Then we also are going to talk about the constant replay of the memory, the post-traumatic, they call it syndrome, whereby this patient, the bereaved family will keep on talking about it again and again, but you should let them talk about it. So things you should do is you should have supportive listening to them. Then we also support with situational awareness, whereby we have that bereavement room I told you, which is quiet with no disruptions, okay? At this time, we're not judging anyone, so there is no right or wrong, okay? Duty of candor, okay? Don't pass any blame cards or something at this point, okay? Remember to use open body language and be focused, okay? Then also be factual. Duty of candor. Tell the truth of what happened, okay? Then, so practicalities, we always we can help the mothers, the bereaved family to get some to have what we call rooming in, with also a cuddle cot, and also to help the family have a look at the baby's body, okay? Then let me share the ways of making memories that we can be able to talk about with the family. So we have that rooming in, seeing and holding the baby for their last time. Then we have to skin, we have bathing, we have dressing, we have blessing or christening according to the mother's faith and what they choose to do. Then we have photography, we have hand and footprints. You know those memories where they put the baby's fingers or the baby's feet, okay? Sometimes they may make a family portrait with the baby's feet or fingers. And then we also have casts. You know those casts where I put, it's like liquid glue. I don't know how they call it, but I love it. You engrave something and put it, like you put your hands and it comes out like that, something like that. I don't know how to explain. Then something else, what should I say? Okay, let me see. What else have we left out? So I'm going to read for you this scenario. You can go on and practice. It's just a scenario because this is a silent station. So I'm going to read for you a scenario briefly, and you can go on and practice. Then I'm going to outline for you under safeguarding and under bereavement how we govern. So you are doing a home visit to Jamila, who is a para 3 on day 12 following a spontaneous vaginal delivery. Okay? It is your first time meeting Jamila. She's reluctant to let you inside and states that she prefers to come to the hospital for appointments. So after some discussions, she allows you into her home. You notice her children and her home are unkempt. Jamila appears to be overwhelmed. On assessment, you identify a 10 millimeters bruise on the baby's arm, right arm. Okay, so using your knowledge of the NMC code, Professional Standards of Practice and Behavior for Nurses and Midwives and Nursing Associates, consider the professional, ethical, and legal implications of this situation. Please summarize the actions that you would take in a number of bullet points. So this is a written silent station. Please write legibly. You can also find other scenarios in the mock midwifery or mock talk. When you go online, you can find the mock. Okay, you need to practice with the mock for more practice things. Okay, so that is just an example of a scenario. However, I want to go through hope you identify the difference between the safeguarding and the bereavement. I'm going to go safeguarding first. So we're beginning with safeguarding, and I'm going to go step by step. So one, you should go on to provide privacy, dignity, being non-judgmental of race, culture, and faith. So number two, where we give a clear evidence-based information. So we are going to give a clear, balanced information that is evidence-based and which follows the hospital policy. Give them enough time to make a decision. Remember, according to the hospital policy. Then, as you're providing individualized care in a holistic manner, this means someone has given you sensitive information, okay, which may be with her partner or with their housing that they are staying. So what does the hospital policy suggest for her condition? Okay, in case you can call for help, there are companies that you can refer the mothers to that can help them. Okay, so refer the mother to the right people to help her. Then, when you're recognizing the importance of providing respective care and continuity of care, you may also refer her to the safeguarding team for continuity of care. Okay, so as the community midwife, let's say this is your day 3 or day 10, you should ensure the mother is safe and the mother is not going to be abused and make a report. Okay, if needed, refer the mother to the GP and also report anything that you think may cause harm to the mother and the baby. Let the multidisciplinary team be involved. Let the safeguarding midwife, GP, community midwife, police, and social services know of this matter. Then, under recognizing the importance of advocacy, we are going to talk about let the mother know their right to care. They have the right to accept information sharing or not. Access their mental health. You should also assess their mental health if they are not consenting to anything that will be helping them. Okay. Yes, they have to know their right to care, but in case it is causing more harm to the baby or to the baby who can't talk for themselves, you should be able to stand up and refer the baby to the right information, to the right people like the social services. You should inform them. You can't keep quiet about that. Okay. Then, in case of bonding, you have to look at if the mother is not in the right frame of mind, what's happening? Are their children having retarded growth or difficult in certain things that they need help? So still under safeguarding, you should also help the mother that she needs to know to bond with her children. Okay, she needs to understand that the bonding is still essential, and you can support her with that. Okay, if it's breastfeeding, help her, ask her where she's finding the problem with a newborn baby. Okay, is she in her right mood? Is she feeling depressed? Find about her mood so that you know how to help her. Okay, then finally you have to do that documentation, whereby you also do documentation briefing, following the duty of candor, and ethics, whereby you do an incident reporting. Remember to write truthfully of whatever happened. Okay, so we're going to go on to bereavement care. This is still a silent station. So what you also should remember, the safeguarding term is used to protect vulnerable people. Okay, so in this scenario, you may be given a stillbirth or loss of a baby. Okay, so you have to explain this in your own understanding to make the notes. Okay, so remember, as you're beginning to write, you have to write your name, date, signature. This should be on every document after you write. If you don't, you will lose out your marks. Okay, so the important keywords you should not forget while beginning to write is providing privacy to your patient at all times, dignity, i.e. cover, make the patient lie down, to have a shower, provide active listening, and not being judgmental in the process in case of a person's race, sex, faith, culture. You should also be able to help the person to express their feelings, beliefs, cuddle, and speak. You'll be surprised how people have different culture when they lose someone, what they do, what they should do. Okay, so you need to give them that space so they open up to you, so you understand how you can help them while still reserving their culture, but also making sure you're following the correct guidelines of your hospital policy. Okay, then provide evidence-based information following the hospital information on bereavement. Provide individualized care. Okay, tailor your so you should tailor your care plan according to the mother's decision she has made. Okay, don't do anything that the mother's not requested, because if she doesn't consent to it, they'll always live to remember and never forget you miscommunicated to them. So everything is crucial at this point. Then we are looking at also continuity of care, whereby it is very important to make sure that the mother gets the right choice of care that they need. So you make a follow-up to the community team, GP, and also social care. They also need to be communicated to. The mother also needs to know that she can consent. She does not have to consent if she does not want a carer, and also she can consent if she wants someone to care for her. Okay, then we also look at being able to see the baby when she's still in the bereavement room, because this may be the last time they see that baby. So that time is very important. Okay, so you also recognize the importance of advocating for the patient's choices, to work in partnership with the patient and the multidisciplinary team. I already told you people who are on the multidisciplinary team. Okay, Then recognize individual circumstances relating to stillbirth and including pastoral care, spiritual care, support of the family, and spending time with her baby. Okay, so they can cuddle the baby. You let them know the baby will be dressed and put in a cooling coat in case the skin is falling off. Okay, sometimes the stillbirth have the skin already peeling, so we have cooling coats that are in the right temperature to keep the body, so they can cuddle, they can kiss the baby, everything that they want to do last with their baby. Okay, then they can create memories, they can create molds, photography in line with the hospital policy. So those molds whereby you can put the baby's arm, maybe the father's arm and the mother's arm here. Okay, so they create those molds. They have those how do they call them? You can also do the baby's feet, anything. Then lastly, we have to document. We're saying we have to document, we have to debrief. We have to debrief the mother and the team that has been working with us. Then we have to do duty of conduct, state exactly what happened without lying. Okay, then we have to do the DETICS, which is incident reporting. Okay, so any questions? Have I tried to be a bit clear? Thank you so much for watching. Me and my doll wish you a lovely day. I think now we're going to go into the evidence-based practice. Okay, we're going to go into the evidence-based practice and see what we can share more. Thank you so much. Thank you for watching. Keep tuned. Please subscribe. Okay, this is very important for us. Okay, subscribe so that we can know what videos you want. Let us know if you need clarity on anything, and I'll be happy to share. Okay, thank you so much.